Today's webinar is called Smoke-Free Multi-Unit Housing Ordinances in New York State, Lessons Learned from California. We're very fortunate to have a couple experts who have been down in the trenches working on this issue in California, and it should be a very informative presentation. So I'll just go ahead and introduce them. So Tracey Andrews is a program specialist with the Alameda County Public Health Department Tobacco Control Program, focusing on smoke-free multi-unit housing efforts through program planning, policy education support, and implementation of adopted policy. She holds a master's in public health with a dental emphasis from A.T. Still University of Health Sciences and a license as a registered dental hygienist. In 2016, she began her employment with the Alameda County Public Health Department after moving from Connecticut to the gentler climate of California. She brings her cumulative experience as a public health dental professional to tobacco control. Paul Cummings has worked for Alameda County for 25 years. He has served as the Tobacco Control Program Director for 18 years. He has participated in successful policy adoption for smoke-free multi-unit housing for 4 local jurisdictions. And I'm Mike Freiberg. I'm a senior staff attorney here at the Public Health Law Center. I should mention too, I am getting over a bit of a cold, so I may need a drink of water. Hopefully I don't go into a coughing fit, but I apologize in advance if anything like that happens. So I'm going to start just by telling you a bit about our organization, the Public Health Law Center. We're located at Mitchell-Hamlin School of Law in St. Paul, Minnesota. You can see the campus here. We are a team of attorneys, policy analysts, and support staff who work nationwide on public health policies in the areas of commercial tobacco control, healthy eating, active living, and health equity. The Public Health Law Center, as I said, is located at Mitchell-Hamlin School of Law in St. Paul, Minnesota, and we think it's important to acknowledge that is in the Bdote region of the traditional homelands of the Dakota people. We recognize that the land we currently occupy comes with a legacy of genocide and trauma caused by U.S. law and policy applied to Native Americans. So the main thing we do at the Public Health Law Center is provide legal technical assistance. And what is that? It takes several forms. We can provide legal research to people, letting them know how various public health issues have been handled around the country. We do assist with policy development, implementation of those policies, and defense of those policies, which can include litigation assistance. We have lots of publications on various tobacco control and other public health issues that are available on our website, publichealthlawcenter.org. And we do trainings, both in person at conferences around the country or online through webinars such as this one, or just meetings with smaller groups of people. The sort of 2 caveats of what we don't do, we don't provide direct representation of clients. So the things I'm saying here should not be considered legal advice. And if you have a specific legal question, you should contact an attorney who is licensed in your jurisdiction. And we don't lobby. We work with some people who do work with elected officials, but we don't lobby directly elected officials and tell them, how to vote or do anything on bills or do anything like that. So we work with a lot of public health employees and other advocates who are working on public health issues. And at Public Health Law Center, we believe that effective policy is equitable policy, especially when it comes to public health and especially when it comes to commercial tobacco control policy. We believe that one-size policies do not fit all, especially in health. And our goal, and the goal of, I would think, all people in our field, is policy that improves the public health. And in order to do that, all groups affected must be considered, especially those who face inequality and oppression. Just to list an example that's relevant to this discussion, if you pass a law to restrict smoking, excuse me, in multi-unit housing, but criminalize smoking in those settings, that can have an inequitable result given issues with the criminal justice system. So that's why when we work on smoke-free multi-unit housing policies, we focus on working with the tenant and the landlord, make sure we provide cessation resources and not criminal penalties. And sort of related to the topic of equity is just the issue of why we call it commercial tobacco that we're talking about here, and want to make it extra clear that we're not talking about sacred tobacco. There is a rich history of traditional products, traditional tobacco products used by indigenous people throughout the country. And those products have not been manipulated to make them more addictive, and so they don't carry the same history of death and disease that commercial tobacco products do. So we think it's really important just to use the term commercial tobacco whenever we're talking about these tobacco control policies. We want to make it clear we're respecting traditional tobacco use. And so phrases like tobacco is harmful or we want the world to be free of tobacco are not enough by themselves. We want to make it clear that we're talking about commercial tobacco products when we use those sorts of terms. So here, when we work on policies, we try to define what commercial tobacco is, as well as what traditional tobacco is, to make it clear that we're not attempting to regulate traditional tobacco in any way. This is a definition that the National Native Network has used. We refer to their resources quite frequently. And just one last point too, before we get into the substance. A lot of you know this like the back of your hand, but a place to start talking about health equity, or rather health inequity, is to talk about the social determinants of health. And Healthy People 2020 defines the social determinants of health as conditions like social, economic, or physical conditions in the environments and settings like schools, neighborhoods, regions, workplaces, in which people live, learn, work, play, worship, and age, that affect a wide range of health, functioning, and quality of life outcomes and risks, as well as social engagement and sense of security. They include racism, discrimination, and bias. Basically, the social determinants of health explain in part why some people are healthier than others and why some people generally are not as healthy as they could be. They also help explain why the leading causes of poor health and death in the United States are chronic diseases that are largely preventable: cancer, heart disease, high blood pressure, diabetes, and commercial tobacco-related illnesses. The root causes of many of these health threats are linked to a person's opportunity to attain good health and adopt healthy behaviors. And of course, housing, which we're talking about today, is one of the key social determinants of health. So we don't want to do anything that adversely impacts a social determinant of health, because that can lead to more health problems. And we'll talk about this more, but in the context of smoke-free multi-unit housing policies, we don't want to look to eviction as a possible penalty for these policies, because that can adversely impact the key social determinant of health, that is housing. So I'm going to start talking about the substance of this presentation by talking about smoke-free laws in New York State. So there are some statewide smoking restrictions that are potentially relevant in the context of multi-unit housing. These are the key provisions from the statewide smoke-free law. That law prohibits smoking in places of employment as its general provision. And I've included the definition here of place of employment. Basically, it's any indoor area under control of an employer where employees perform services. But then it lists a bunch of examples, some of which I want to point out here because I think they are relevant to our discussion. So one example of a place of employment where smoking is restricted is offices. You do have those in multi-unit housing very often. So, you have rental offices there. So rental offices should be smoke-free. Banquet facilities is another one that's listed here. I know some apartments and condominiums have community rooms that can be used for gatherings, and maybe those would qualify as banquet facilities as long as employees perform work there. I assume maintenance staff for the apartment complex has to clean them periodically. Restrooms. Any public restrooms in any multi-unit housing building should be smoke-free. Elevators. Any elevators in the building should be smoke-free. Hallways, any hallways in the building should be smoke-free. These are just a few examples of places. This obviously doesn't cover private units or outdoor areas, but I did want to mention that there are some areas in multi-unit housing that should already be covered by the New York State smoke-free law. In terms of regulating smoking in homes, there are also some provisions related to home-based childcare providers and college dormitories, but I'm not going to focus on those today. The law does say both smoking and vaping are restricted, and those terms are also defined. So here are those definitions. Smoking includes what you think it would include, but it also includes smoking cannabis or using an e-cigarette. So those are the laws in New York State, but because it's an important jurisdiction, I do also want to briefly mention some laws in New York City. So New York City prohibits smoking in public places. Now, the state law that I just showed you talks about places of employment. New York City talks about public places. They're both perfectly normal ways to structure a smoke-free law, but they do have some different terminology. So in the definition of public place, New York City specifically includes common areas of multiple dwellings. And New York City also has a law requiring owners of multi-unit housing to have a smoking policy in place and requires disclosure of that policy to tenants and prospective tenants. And that's the law you can see on the last two lines here. It's not as comprehensive as the laws we're going to hear about in Alameda County, California, but it is a start and it's worth highlighting here. So turning back to New York State, the cannabis laws have a bit of a wrinkle in the context of multi-unit housing. So generally speaking, smoking marijuana is treated the same as smoking conventional tobacco products in clean indoor air laws. However, if a resident is claiming that they need to smoke marijuana for medical purposes, it can get a little complicated. So the Office of Cannabis Management has stated pretty clearly, you can see the quote here, that a landlord cannot refuse to rent to a tenant who consumes cannabis, but landlords, property owners, and rental companies can still ban the smoking or vaporizing of cannabis on their premises. So that's a very helpful statement from a public health standpoint. But it does get a little complicated when you look at state law. There's a state statute that says that no landlord's smoke-free policy may be construed to limit the certified medical use of cannabis. So these two statements are kind of at odds with each other, but I did want to point out the discrepancy. I don't know that the certified use of medical cannabis typically requires that it be smoked or vaped. You'd think the cannabis could be consumed in edible or pill form. So I think, from a public health standpoint, it's certainly preferable to restrict the smoking of cannabis. So the resources we talk about here generally do that. Now, many local units of government have started restricting smoking in the actual living units of multi-unit housing. According to this screen grab from the American Non-Smokers' Rights Foundation's website, there are currently 79 such laws, and they are all from counties and cities in California. And actually, I forgot to update this screen grab. It's out of date. I think there are now 2 more, so we're up to 81, I believe. And there are a lot of things to think about when you're thinking of local policies to restrict smoking in multi-unit housing. And Tracey and Paul are going to talk about these in more detail, but just to provide you with sort of a brief summary of some of the things you want to think about when you're looking at a smoke-free multi-unit housing ordinance. You'll want to think about what products are restricted from use. So e-cigarettes, cannabis, conventional cigarettes and cigars, those are some things that come up fairly often. But then we frequently see new products, heat products that claim to be heated and not combusted. So you'll want to draft any ordinance in a comprehensive way that includes all the products that I've mentioned that you want covered. You probably do want an exemption for traditional tobacco products for the reasons I talked about earlier also. You'll want to think about where the policy applies. So you'll want it to apply presumably in all indoor areas. That's certainly strongest from a public health standpoint. You'll probably want it to apply to at least some outdoor areas as well. Some places have a setback provision, so it's just outdoor areas within 25 feet of indoor areas where smoking is restricted, or you can prohibit smoking on the entire grounds of a multi-unit housing complex. Some places do have designated smoking areas, so that's something that can be considered if it seems like a necessity from just to get everyone to agree to the ordinance. You want to think of when the ordinance takes effect. You'll want to be able to provide sufficient notice to residents. You'll want to involve residents with the process. This can help create buy-in. And you'll want to think about how enforcement is going to work. Laws are only as effective as they are enforced. So you probably want to tie it to existing lease violation procedures, have some system of graduated enforcement in place. So stepping up for people who violate the ordinance, sort of stepping up the penalties, but you probably do want to avoid penalties like eviction because that can exacerbate housing problems. You'll want to think about how you're going to treat evidence of violations, and you'll want to make sure you provide resources to help residents with cessation. So those are just some of the things to think about. As I said, Tracey and Paul are going to go into more detail on these during their portion of the presentation. We do have a model ordinance, model smoke-free multi-unit housing ordinance on our website that's tailored to New York State, that addresses these issues. So I just wanted to highlight that, and I will put when I'm done presenting, I will put a link to this ordinance in the chat so everyone can see it. But this is sort of the gold standard for what a smoke-free multi-unit housing ordinance should look like. It includes all products. It includes all multi-unit housing types, so apartments, condominiums, cooperatives. It includes all places, both indoor and outdoor. There is some optional language in there for a designated smoking area that makes that area as limited as possible to make sure that the public health protections are maximized. And it includes graduated enforcement, so there's no eviction, and it does focus on restorative justice type practices. There's a fine schedule that's based on income, and these provisions were worked on with an advisory committee that included representatives of housing and social justice organizations, because we do want to make sure we don't exacerbate the housing inequity or anything along those lines. So this is my contact information. I'll put this in the chat as well. If you'd like to get a hold of me, please reach out. You can reach out to me directly or to the Public Health Law Center generally. But with that, I will turn it over to Tracey and Paul.
Good morning from us, and good afternoon to you guys. So I'm Paul Cummings, Tobacco Control Program Director, and Tracey.
Hi, I'm Tracey Andrews, a program specialist with the Tobacco Control Program in Alameda County as well.
So I'm going to do a sort of an overview of where we are, and then Tracey's going to get into some of the details, and then we'll be available for questions at the end if there are any. So thank you. So Alameda County is in the Bay Area. Oakland is our largest city. We have 14 cities as well as unincorporated areas. And most of the unincorporated areas are clustered in the middle of our county, in between the 4 and the 3 there. Castro Valley and San Lorenzo are unincorporated communities of our county, and there are a couple of smaller ones as well. The Board of Supervisors passes laws for the unincorporated areas, so and they represent the whole county. So even though predominantly only 2 supervisors represent the residents of the unincorporated area, all 5 of them vote on the laws. So it's a little confusing that way. Next. So we had a work group that we started in the spring of 2021 to move the policy forward. There were 3 main objectives. We wanted to protect all persons in multi-unit housing from all secondhand smoke, not contribute to evictions or housing insecurity, and did not want the penalties to lead to the criminal justice system. So I wanted to make sure that if someone didn't pay fines, that didn't turn into a warrant. Next. So this is for smoke-free multi-unit housing. It's generally been a slower process than some of the other tobacco control policy issues that we've worked on. And certainly, the last couple of years as well had made it slower with the pandemic sort of getting in the way, as it were. And just, I think just real briefly, smoke-free multi-unit housing policies first started appearing in California and being discussed in Alameda County in 2008. And at that time, I was sort of hesitant. I thought that this wasn't really going to go anywhere because we were trying to regulate activities in people's homes. And I think that what has happened in California is that people are not being exposed to smoke when they are at work. They're not being exposed to smoke when they go to restaurants, and then they go home and they're exposed to smoke, and they've had it, and they don't want to be exposed to smoke in their home. And so there's been a real attitude change around that exposure over time. So so we worked with our county council and drafted an ordinance in July of 2021, which we then presented at a series of municipal advisory commission meetings across the unincorporated areas to gather input from different subsets of the community. We reported back to our board of supervisors, and first reading was in December, and it was passed in January of 2022, and with an effective date almost 6 months out. So we tried really hard, and I think we did a good job of covering as many units as possible, and in the units. So patios, balconies, hallways, elevators, everything inside of units are all covered, as well as at least a 25-foot buffer around the building itself. Next. Yeah, so apartments, townhomes, condos, senior living facilities, and I think that this is really good, because one of the things that we have found is that in a lot of condo complexes, there are actually units, quite a few units that are being rented. So it's there is no crystal clear delineation between owner occupied multi-unit housing and rental occupied multi-unit housing. So it's good to have as much coverage as possible. So, I think, and Michael mentioned this, but the ordinance and the way we have educated people and the way we have really worked on this is around a behavior, and it's really making sure that we are not criminalizing people who smoke, and that the ordinance is not against those people. It is about a particular behavior that can't happen in certain locations to protect people's health. And so it includes traditional smoking, vaping, it includes all tobacco products, as well as cannabis, marijuana, and would also include any hemp products as well. So we required that the landlords notify the tenants, but we also tried to notify all the tenants as well. So we had 6 months to develop the outreach materials, and Tracey will get into that a little bit more later on. But we tried to make sure that there were resources for people to know about the ordinance, as well as to post signs about the ordinance, so that it could be complied with. So early on, I think there was a discussion in our community about whether it should be something that the landlords enforced, or whether it should be something that is enforced by the jurisdiction. And we went with the route of it being the jurisdiction, and I really strongly support that at this point, because we think it's really protective against evictions, that the landlords aren't involved until near the end if someone is frequently and consistently not complying. So our program accepts the complaints, we sort of verify them, we will then send out up to 3 educational warning letters, try and space them out so that people have a chance to comply. If there isn't compliance after 3, then we'll share all the information with our code enforcement colleagues, and they will begin a fining process. And fines are $100, $200, and then $500 for the third and any subsequent violation over a 3-year period. After that third violation, if it is a tenant, then we would notify the landlord as well about their non-compliance. But at that point, they've already had 6 warnings and chances to comply. So if a renter does not pay the fines, they go to collections. It doesn't go to a warrant, means less likely that we get money, but it means that it less likely that someone interacts with law enforcement. If it's an owner occupied unit and they don't pay fines, then it is goes into a tax lien on their property taxes. And I will pass it to Tracey. So thanks, Tracey.
Thank you, Paul. I just wanted to bring you through the community engagement impact that the adoption of the policy has. And we were really fortunate to work with BASTA, which is a Bay advocacy strength in through activism. And what the greatest part is, they knew their community. They helped pre-adoption by bringing the topic to the council members in like an open forum section of the agenda. And then they'd also really brought the residents there. They had the residents' statements and stories, and they were always there to speak. They brought language translation capability with them so that all people from the community could be heard. And they got the ball rolling. I cannot stress enough how helpful it is to work with somebody who knows their community, who knows how to go and get something from their community if you're being asked by council members or questions about the community. Paul mentioned there was a series of meetings we had to go and they all showed up at those meetings. We would have tons of support. When I say tons, 15, 30 people, but there were youth, and the youth were very engaging. The Board of Supervisors were so impressed with them that they just kept talking about them. So you have to remember, this started 3 years before the policy was passed. So I'm going to bring you through the last 6 months, which was passing the policy and then implementing. In the pre-policy adoption, this slide is kind of busy. I just wanted to make you aware of some of the things that the community will do, like door knocking and surveying, meeting with different agencies to get them on board, getting support letters. They met with housing, they met with landlords. As I said, they came to all the council meetings. The greatest thing is that every time they'd go out to do something in the community, they would, bring materials to their booth and really talk about smoke-free multi-unit housing and secondhand smoke. Post-policy adoption, what was great is they went out and they informed all the large multi-unit housing property managers of the ordinance, and then also drove them to our website to say, hey, there's resources, work with Alameda County Public Health Department and the Community Development Agency. You're going to see these resources on their slides. And then we had created a work group, as Paul mentioned, to do the implementation. And so they came in as partners on the, especially when we came to some tough implementation solutions, which I'll go through briefly. They also continue to educate the community members about passing the ordinance. It was constantly like, this is how you make a complaint, and here are some resources. So they tried to make it as easy as possible for people to understand how to use the ordinance. And I have to say they were very successful. We mentioned the community, like we had gone out to these different meetings. So just this is quickly to show you what support there was. Basically, there were 41 residents that were affected by the drifting secondhand smoke and wanted something done. We had supportive letters from the community agencies that I mentioned before. They really wanted the ordinance to be 2 or more units to include duplexes, because at some point there was some conversation about, oh no, well, we don't want to do duplexes. Let's make it 3 units. They wanted the no smoking clause in the lease. There's also quite a few of the tenants that were saying, no, we don't mind removing the eviction protection because we want people to comply, which was, we were actually shocked at that. And then the fact that they, one particular group wanted the ordinance to go further and apply to single family homes. Some of the concerns, you mentioned landlords. So rental housing associations were against it in the beginning. They really just wanted to have like private policies to their smoke-free policies on their properties versus an ordinance. And we actually went out and met with them, and just to clarify that there would be no fines or taxes imposed on the housing providers, because the realtors were bringing that subject up as a possibility of, it's going to cost you more to rent your property and there's going to be hidden fees. And then we offered educational seminars to them, or webinars, and we offered them materials, which they took us up on. And then we had a few, mostly rural areas, where they just felt like that it was government overreach and property owners should decide this, but also they were like, this issue is not relevant in our community. We also got a lot of pushback for people who felt that the code enforcement agency was already too busy, and how are they going to have capacity for this? So basically, these were the results. The Board of Supervisors felt that the policy would only affect the urban growth boundary. So properties within the urban growth boundary, there's about 140,000 properties, and then the entire Alameda unincorporated county is about 150,000. So we were psyched. We were like, okay, this is okay. It's not perfect. You want 100% of what you go for, but this is all right. And then they directed the public health department to create the protocols for the warnings, which you saw, and to provide education to the housing providers, and then to return a year later and give an analysis of the compliance and enforcement, including any evictions, which we did in July of this year. So I'm just going to give you a few barriers to the implementation and just some lessons we've learned in the last 18 months that this ordinance has been effective. So as I mentioned, we were just like, who does this apply to? Because the urban growth boundary is sort of an imaginary line within the county. So thankfully, our partners on our implementation team at the code enforcement, they said, oh yeah, we can take the properties and figure that out. So I wanted to mention that we didn't have a clear, as Paul had showed you the Alameda County before, this really defines the unincorporated area. All the gray is the unincorporated area. You can see it's pretty large. just where that color splotch is basically where the urban growth boundary is. So you'll see the splotch on the Hayward area. So it looks like it's not that much, but it's huge. There's a huge amount of population there. And then all those gray areas, there's not really many people at all. We went to the county tax assessor and we used their list to identify the multi-unit housing properties by their codes, which means when they give you 40,000 properties, you now have to figure out, you have to multiply it out as according to, is it a duplex? Is it a triplex? Is it a 5 or more units? So when we got to these 5 or more units, that meant it could be 1,000 units or it could be 6 units. And we really had no idea of how to assess how many people or where those places were. So thankfully, the Housing Community Development Agency also had a list on all the units that were in complexes of over 5 units, just so we kind of had an idea of the numbers. And the other, we were able to really estimate like the number of multi-unit houses we needed to reach. So I'll just give you one little like thing that happened. We mailed out 55,000 plus postcards that basically announced the ordinance. And the vendor that I was working with, we couldn't really do it through city. We couldn't really do it through, it was just very complicated. So he suggested I use the Every Door Direct mailing program, which basically showed me all the routes, and I could like look at a route and match it up with the tax assessor's codes of the property, the property addresses. And so I could at least get all those people that I had on the list. I could make sure that they got mail, and I didn't have to worry like, well, are the apartments numbered or lettered, or, I didn't have to worry about any of that. So the only caveat was that it also went out to the single family homes. I did not have them go out to the businesses, but I picked all the residential areas. So we had to make the educational material a little bit more like, hey, I just want you to know this ordinance is happening, so that when people in the single family homes got it, they didn't think that they had to comply as well. But the great part was we also, we sent them to medical, dental, and veterinarian offices, as well as motels and hotels. The long-term care facilities were already mostly smoke-free, but we just, sent a reminder. And mobile homes were exempt, as well as single-family homes, as I mentioned before. And then we started to go out and give presentations to those groups. Here's what the postcard looks like. I'm showing you this as an example because a lot of people in the community wanted us to make sure we had different languages that said, for cessation resources, for making a complaint. There's a QR code in there. We borrowed this from Contra Costa. They had done this great graphic, and we really loved it and asked if we could also mirror ours after it, and they were very, very happy. All right. So I already mentioned about this. These are just the resources that we have on our website. We really, what I would try to do is when I get a complaint, I didn't know, I really had no idea where the landlords live, because they don't necessarily, they own the property, but they don't necessarily give me their other address. And so anytime I had a complaint and I would say, hey, are there signs on your property? And they said no, I would reach out to the landlord as a, hey, I don't know if you know, but there's an ordinance. And we would get into a nice conversation, and we'd offer them, the landlord fact sheets, tenant fact sheets, also resources on like notification letters, so they could notify the residents in their properties about the ordinance. What it did was it started to build relationships with the HOAs and the property managers, which now, while we're in enforcement, is really helpful. They're actually our partners in enforcement. I just wanted to give you a couple of lessons learned. One is, engage the housing associations. There's like a sweet spot. If you start to get a policy together, you want to go and talk to them about it. You don't want to go too early before the policy has momentum, because they could possibly squash it on you. Paul already mentioned favoring the jurisdiction enforcement over the landlord and the HOA enforcement. And then to work with the agency responsible for enforcement to help them develop the enforcement process before policy recommendations are submitted to council members. This is so important because as soon as you talk to a city who has an ordinance, who has now gotten a code enforcement officer involved, their first thing is like, I don't know how I'm gonna, police this. And so it's really good to kind of have that information ahead and have those discussions ahead so they know going into it what their role is going to be. Really listen to the community. Our community members, just kept talking to us about different things that they wanted, just making things easy for them. And then I just wanted to mention that first year, the first 6 months with the implementation group, we actually kept we still loosely have the work group together, and we come together if we have a legal question or some sort of enforcement question comes up that's a little bit unusual. No case is ever the same. And I do want to say, if you can prepare your staff for conflict resolution for handling the complaints, that's very helpful. I also put in a slide here about resources. So you really need some sort of, staffing is obviously huge. Someone to set up the program, develop the education materials, the website, systematize the complaint responses, prepare other process and fee structures that you're going to work with. And then you're probably going to do program check-ins, collect data for reporting, as well as handle the complaints. And then enforcement's going to review the referred cases. They also will create a staff report. They send out the notices. They will do a lot of correspondence. Sometimes they do what they call a knock and talk, which is where public health does it as well, where we go out and actually talk to the complainant or the alleged violator, and just kind of assess the situation. And then if there's a process of an appeal, there is a process to handle the appeal hearing. And so all that has to be created and sort of, set up to go once you're accepting the complaints. I can't stress enough the language interpretation resource. So Public Health Department does have a way to provide that if we need to. And, that's just another thing to look at if you're dealing with multiple languages. Okay, just really quick, these are the types of complaints we've gotten over the last 18 months. And remember, I sent out 55,000 plus postcards, right? We've gotten 63 complaints to date in the 18 months. And then, there's 20 from the cigarettes, 17 from the cannabis, 18 complaints from both, and then 8 complaints where they didn't really know. We get a few sort of heavy narcotic drug complaints too. So they just kind of say that they don't know what it smells like, but it smells really bad. So we're not supposed to really be dealing with that. So I just wanted to show you kind of where we land here. We feel that a lot of, compared to the amount of complaints we've gotten, that the education kind of worked. We've made a really great relationship between the Public Health Department and code enforcement. As a matter of fact, they really want to continue to work with us. And then just like what I mentioned was about the managers and the HOAs who are really supportive. They are trying to police and do fines and, let us know when there's a situation. I want to mention only 7 complaints went to the level of fines, and there have been no evictions in 18 months. And that ends my presentation, and we're ready for questions.
I just wanted to add 2 things really quickly. So first is that the 63 complaints, that doesn't sound like that much maybe, but it's actually a lot of communication and pretty labor intensive. So just wanting people to be aware of that. And the other piece which we didn't put in here, we initially had a couple of different websites where people could submit complaints, and that they could also leave complaints on our phone line. And it got really, really confusing. And so we would end up getting the same complaint in all three places, and then had to do a lot of like, is this the same? Is it different? Trying to match things up. So trying to systematize that so that there's even if we're trying to get the information from multiple areas, that it all gets funneled into one place where the complaints go has been really helpful.
Thank you. That was great information. As I said, we'll turn over to questions now. If anyone has any questions, please submit them in the Q&A box, and we're also monitoring the chat box in case any end up there. There was a comment from Jennifer earlier. She said, I was just in Alameda over the holidays and saw a no smoking sign on Park Street. You actually make at least some streets smoke free. So that was nice to see. And we did actually get a question before prior to registration that just asked what the smoke-free housing landscape was like in Alameda County before passage of the law. And that kind of seems to kind of relate to that one. It sounds like you already have some outdoor smoke-free restrictions. I guess I'd just be curious to know if any of the previous smoke-free work you've done kind of helped lay the groundwork for the smoke-free multi-unit housing ordinance.
I think so, in that, so that the in Alameda is a separate city within Alameda County too, and so they have a pretty strong law as far as what's happening in their commercial areas, which isn't reflected the same in our unincorporated areas, but there are still in almost every jurisdiction in our county a requirement that of at least 25 feet from windows and doors of workplaces. So there is sort of I think a fair degree of support in the community and at the policymaker level for protecting people from secondhand smoke.
Yeah, thank you. There was a question just submitted to the Q&A asking about whether you handle cannabis complaints, because they point out in New York State, the Office of Cannabis Management and the Department of Health are separate. And that means that the Department of Health doesn't handle cannabis complaints. They refer them to the Office of Cannabis Management. So do you have any comment on that?
Yeah, I can comment on that. We handle secondhand smoke complaints, and that's kind of how we frame it. And so it because cannabis is included in our ordinance, it kind of doesn't matter what they smoke. It's about that they're smoking in the presence of their neighbors and how to get them to smoke away from their neighbor or another area. I want to mention, we've had 4 people go through cessation, which I think is kind of a huge thing out of those complaints that I mentioned. So people will ask you for materials or where can I smoke? How can I smoke?
Great, thank you. There was a question just submitted by Christine. She asks if there are plans to evaluate impact on either smoking prevalence or self-report of secondhand smoke exposure.
There are not, but I think what we are planning to do is probably do another round of education and see whether we get an additional, series of complaints that sort of, as more people maybe become aware of the ordinance. Yeah, so I think that it does bring up, like, are people really being exposed to less secondhand smoke, or is it just in these few cases where we resolve them, that's happening and it's unchanged for everybody else? So that's a question that we don't have an answer to.
Thank you. There was a question submitted with the registration where they asked for policy verbiage for medical marijuana. And I'll just point out to that. So our model ordinance, which I linked to, and there was a link to it in the chat, which I mentioned, and there was a link to it that Stephanie posted in the chat, doesn't carve out medical marijuana or anything. As I mentioned, the law is a little ambiguous in New York State about that, but the model ordinance is kind of a best practice. So, the best practice from a public health standpoint is to protect people from all smoke, whether it's commercial tobacco or cannabis. So, if, you certainly could reach out to us if you're getting to a point where you think we're working on policy development and there's been a request for some sort of policy verbiage for medical marijuana. I think you'd want to be very careful about how you drafted that. So we'd look at it closely. And I don't know, Tracey or Paul, if you have any additional comments on that, or we could just leave it at that too.
I think all secondhand smoke is what we want to protect people from. In California, we've seen that what we're calling big cannabis has really sort of focused on sort of the larger cities in the state. So in the Bay Area, Oakland, San Jose, and San Francisco, they've all been discussions around smoke-free multi-unit housing, and the cannabis lobby has really come out to squash that. That hasn't been the case in smaller communities. I think it just, regardless of whether they want to squash it or not, this is important for people's health.
Yeah, thank you. So you mentioned that the Rental Housing Association at least opposed the ordinance initially. Were there any landlords who supported it? I mean, I could see a perspective that, a landlord might think at least, they don't want smoking in their units because it's expensive. There's a fire risk. It's expensive to clean. And then this way they could just at least, put the blame on the local unit of government, say like, hey, my hands are tied. I'd love to let you smoke here, but I can't do it. Did you encounter anybody responding in that fashion?
We actually had a president of an HOA want the ordinance because he felt that they couldn't police the ordinance in their condo complex. So he was in favor of it and really kind of talked about that. Like, hey, if there's an ordinance in place, it's going to give us more teeth on us trying to, enforce privately. So that kind of sparked a couple of other people. Honestly, the realtors public speaker was the voice of against it because he thought that he was just speaking for the whole all realtors. He just felt that it was going to lead to more taxes. He didn't understand how the enforcement process was going to work and thought it was coming back to the landlords. And I should say Contra Costa County does have a landlord enforced policy where the onus is on the landlord to do the enforcement. So he could just have known that.
Right.
Yeah. And one of the things that they pushed back on was the idea of putting this in the lease. They felt that they argued that the landlords did not want to renegotiate all their leases. Mm-hmm. We thought that was going to be a big concern at the time, and in practice it hasn't, and we felt good about it because it doesn't create an additional potential for eviction that so we're actually been okay with that.
Great. So just want to put out a last call. If anybody has any questions, please do put them in the Q&A box. I'll just mention one thing. So Tracey, at the end, you mentioned there have been 63 complaints, but no evictions at this point because of the mm-hmm. law. I know you did say that the landlord only gets notified after a third violation. And you also said some tenants actually wanted eviction to be a potential penalty. Do you think there's a likelihood or a possibility that this could at some point lead to an eviction, or is a situation where that is a possibility? I mean, like a lot of times I hear there's other issues going on with the tenant too, mm-hmm. in addition to just the smoking and, other violations of house rules. If you could just expand on that, that'd be great.
Yeah, I mean, before it gets to that level, we've gone out and talked to, usually one of us handles like the violator and one of us handles the complainant, so that we can then discuss between ourselves like how best to handle the situation. But honestly, the ones we're having the most difficulty with are the owner occupied, because they're just, it's their house and they should be able to do what they want in their house. And that's actually one of the cases that's gone. If it could have evicted them, they would definitely be evicted by now. But obviously they own their place, so they're just getting fined. And it ends up, usually in those situations, there's a lot more going on, as you mentioned, and we bring in other resources. Sometimes we bring in a conflict resolution place. We bring in the HOA or the landlords to kind of talk and have a conversation. And I know that a few times attorneys have been contacted as well.
And just like when we take the complaints, I think we also listen to whether, if they're also complaining about like this, where this person parks and, what they do with their garbage and how they play their music or whatever, trying to make sure that, we don't, contribute to someone trying to bully their neighbors and or use this as a way to address some other issue that they're having with their neighbors. And we've had a couple circumstances where we really felt that was the case, and where we've been able to sort of walk a line so that we felt we didn't contribute to that. But it was just something we felt we needed, that as it's gone on, that we're sort of become more aware of, and it's worth sharing.
Yeah. Well, thank you.
And
Sure.
I just want to add one thing. The tenant cases, most of them are resolved within 1 or 2 letters. Most of them, they get a letter, they change their behavior, or they call us and ask us what they can do, and that it's pretty well solved.
Okay. Well, thank you both so much. I want to be respectful for your time. If anyone, thank you for bringing your expertise across the country. I really appreciate it. If anyone has any questions, feel free to reach out to me. I can pass the questions along. But I really appreciate Tracey and Paul, both of you, lending your expertise to advocates in New York. It's really exciting what's happened in Alameda County and California in general, and hope one of these days a city or county in another state is going to pass one of these ordinances. So we hope it can be in New York State. So feel free to reach out to me if anyone has any questions. But thank you again, and really appreciate your time.
Thank you for inviting us.
Thank you.